Well, 3 minutes past 9 a.m. and of course welcome to our last hour Smart Men's Business. Always here to keep you updated in line with business information and whatever related topics that we have here for us to share and find knowledge on how to live in a competitive and sound environment. Well, my name is Maseket Sime. Been here from 7 till now driving you. I'm going to drive you till 9:55 a.m. so get ready to have your ears blown away with this kind of information that we always here to give you. Well, of course, we're still talking about mental health here, and of course we're going to be looking at the statistics of not only Uganda, because I was basing here in Uganda because that's what I know that is happening, but then we see here that mental health disorders are a major public problem in Africa, affecting 112 million people. That is 11% of the population. And of course, most of the common disorders, we have depression, we have PSTD, we have substance abuse disorders, and of course we have psychiatric disorders, madness, things to do with the brain. And of course, here are some of the things that some of the African countries that have done to make sure that they can curb the mental disorders that are actually affecting the people. We could learn a thing or two also with our country here, Uganda. Well, of course, they have tried to develop mental health policies and strategies, and of course a number of African countries have developed national mental health policies and strategies which outline their plans on improving mental health services and care. So this is a department where people need to be critical about, because the more people we lose into mental health facilities, the more we're losing out on potential leaders, we're losing out on potential traders, we're losing out on potential people, potential minds. So definitely we have to find policies on a way that we can harmonize and make sure that everyone is mentally sound and able to do what they're required to do. And of course, here we see Nigeria. Nigeria launched the National Mental Health Policy 2013. And of course, the policy aims to improve access to mental health facilities, reducing stigma associated with mental illnesses, and promote mental health awareness. So that could be something that we could learn from. And of course, our very own neighbor Kenya also launched the National Health Policy in 2015. It was to integrate mental health services in primary care, improve the quality of mental health services, and reduce stigma associated with mental health. If we could only have that, improve the mental health services, then we also do away with stigma. Could actually be having a sound Africa, And of course, also Ethiopia coming in through here. Also, they had a mental health policy in 2016, also aiming at mental health services, stigma, and also promoting health awarenesses. So that is, it is important to note that mental health is a complex issue. It's very complex, and of course it needs, a wholesome mind to come and find probable solutions on how we can go about all this. And of course, here in our report you see that many people in low and medium income countries face daily challenges, and their mental health has been an additional burden. That is according to the psychologists in Uganda that are trying to be of help. Well, here in mental health is an active state of mind which enables a person to use their abilities in coordination with the common human tenets of society. So therefore, despite its importance, it's often less prioritized, which I must say, less prioritized among its health conditions. While you're the mad people, you're going to be sorted after. So these with cancer, these with hypertension are going to be dealt with, which I believe, because people who are in mental facilities need a lot of care. They need you to be really up there just in case they get a concussion or anything. You have to be there. The talk alone, there is a lot of depression, anxiety. So definitely that is what is happening here in Uganda. And of course, with the cost of living, the rate of unemployment, which is leading to high abuse, substance abuse, kids are doing drugs, they're doing drugs, weed. Oh goodness. If you go to different places, you see people taking shisha, people are confidently having weed cake, people are confidently having weed cookies, and it's just normal. How? There's madness attributed to it. All that can lead to madness. So please consume whatever you consume. Alcohol, excessive alcohol is not good for mental issues. Your liver, your kidney is going to be affected. Away from your mental health state, your liver is also going to be affected. So please do find something that keeps you more productive. Be inventory, be innovative. You never know, your innovation would actually scoop you a portion of the 500 billion Ugandan shillings that was allocated for the facilitation of inventory in Uganda. Well, of course. Just right about now, of course, we have Honorable Judith Aldiak, and of course, representing Kole District, and of course, she was telling us how we can actually make sure that we have a sound Uganda, because health is indeed wealth. Let's have a look at what she has to say, and we shall be right back to finalize with this.
Actually, I agree that health is wealth, because a healthy person is a very productive person. And a healthy nation is a productive nation. It's the nation that can prosper. It is the nation that can grow and develop. So I'm here talking about public health, which is something that should be taken as a priority in this country. Much as I know, the country that grows faster means its people are also healthy. So I'm bringing this because I've seen a lot of disease burden in this country. More than 75% of the diseases reported at the health facilities in Uganda can be prevented. So a sick nation will never prosper, and it will never develop, it will never grow, because health as a priority is considered in this nation, and it's considered worldwide as something which is very key in the development of the nation. So, as I said that more than 75% of the disease burden is reported at our health facilities. What does it mean to me as a policymaker, as a legislature? What does it mean to me? It means priority of the national budget should be given to health, but should not only be given for preventive measures, it should be given to preventive measures. So I'm meaning that public health as a whole is the priority of a nation. We have seen His Excellency, the President, ever talking about prioritizing prevention of diseases in the society, in our communities. So as I've been in this parliament, I've seen the budget, the yearly budget, the national budget. There's something that we have not yet met, and I've seen that even the budget declaration that involved all the leaders almost in this world that converged in one meeting and agreed on one thing, that health should be given 15% of the national budget. So I'm seeing that as Uganda, we have even not yet reached the 15% of the national budget going to health services. Yes, and I've seen that much of the budget of health goes for curative services, not preventive. So where are we heading? The disease has come. We have not prevented it, and we are looking at curing the disease after it has already affected the people. So one thing that this country should look at is preventing the disease before it has affected the people. That is the priority. so that everybody becomes productive. Somebody who is sick will never think of doing any business, will never think of earning any income, will never think of even sending his own children to school, because someone is already sick and somebody is already down, which means that person is not productive. Because for the nation to grow, it is a collective effort for each and every citizen. Each and every citizen that pays taxes is really a big contribution to the nation. So when someone is already sick, and when the majority of the population of a country is already sick, then that country will never develop. Now, take for example, urban centers. Just take it and compare it with the rural setting. The disease burden is more in the rural setting than even in the urban areas, because we have seen a lot of development. People have money, people are able to treat themselves, yes, because the more you earn, the more you are able to access better health services, which means the poor who cannot access better health services cannot even spend a penny in order to really bring back their health that probably might have been affected. So I'm saying here that first priority is the health of the citizens, that this country, as Uganda, should really take it up very seriously. So I think that is all I can say about uh, health being wealth that everybody should appreciate, everyone should work for, and the nation and the country should take it as a priority. Every ministry, every department, and every agency always employs people to work with. So there's something that we have to look at in the environment where somebody is supposed to work, because it affects their mental health. Yes, because somebody who is not having a very good working environment, take for example, a working environment can be good salary, something that can promote a good working environment, that I'm working, I'm motivated, I'm getting paid, I'm happy because I'm employed and I'm enjoying my job. So in an environment where somebody cannot enjoy the job he or she is employed to do, then there's a problem. There's a problem. So we are heading to mental health challenges. So in a work setting, there should be, first of all, the rules, the regulations of the workplace. So workplace policies are supposed to be in place. So what does our policy say as far as even this parliament is concerned? Is the environment friendly to the members of parliament or to the employees of parliament? I'm just taking parliament as an example. Just like any other place where employees are working. So a bad working environment will first of all not motivate a worker. So which means that will affect the mind and will also lower the concentration of that worker, and eventually the outcome of what the department or the ministry or the agency or the workplace expects at the end of the year. You know, sometimes they do yearly evaluation and they want to know what achievements they have so far made. But you will find that, okay, a workplace may be limping, may not be achieving its goals and objectives, because much as there are many employees, the working environment is not friendly. Okay, there are people who mistreat workers. There's a lot of mistreatment that we hear about in the private companies and also in government settings. I'm not isolating the government employees, but I'm taking every employee together. So meaning the leadership of any MDA should first of all take it that they are affecting the mental health of the workers. This is something that can be addressed. Okay, regular meetings can also help in really bringing people together, and also the behavior of the management of such an environment. So all in all, I'm saying employees must enjoy their work. There are some people who get little salary, but they enjoy their work. They feel motivated, and every day they are going. Why? because they are talked to every day. There have been regular meetings. They are being appreciated. The, the manager or the boss or someone who really is in charge of that job will say, okay, now I have to appreciate you. Just calling somebody to your office and talking to that person will motivate, even if he's getting little money. Compared to somewhere where you're working, you are well paid, but the working environment is not good, you are annoyed every day, you are not at peace, you would rather leave that job and go for a smaller earning when you enjoy your life and your mental health is not affected. So I'm saying people should embrace workplace policies as far as mental health is concerned.
Well, of course, you've heard it from Honorable Judith Hadiak, and she said something actually towards the end that was really got to my mind. Really go to a place that you know it gives you a sound mind. Okay, yeah. People are really earning less, but then they are really peaceful. They're extremely peaceful. Yeah, be at a place where you find peace. That is what I always actually tell my people, my friends, you know, be somewhere you're at peace. When your colleagues are, you know, be in an environment that gives you a good state of mind instead of being depressed. Because I know that toxic workplaces, trust me, that the more toxic, the more mad you will, the more mental issues you have. You could be earning money, but then who are you talking to at the end of the day? Are you involved? Are you even a little bit of appreciation actually motivates some of these workers. Give them a tip if they have worked, employee of the month, stuff like that. It actually does really help. And of course, she mentioned something about government prioritizing public health. Definitely that could be one of the priorities that we could be looking out for. And of course, here the child and adolescent mental health policy guidelines were designed to promote mental health and prevent mental, neurological and substance use among children and adolescents. And of course, these guidelines were given in a statement by the government of Uganda to set a clear direction in development of mental and neurological and substance abuse control services, such as to aim to ensure that these services are readily available to all children and adolescents in Uganda. She said, actually, the Honorable said, you know, this does not affect adults, even children as well. So that is why, you know, when a child grows up from an abusive environment, from school or some could be even school, even home, you know, they grow up with anger issues, with very many disturbing issues. You find someone is really angry the whole time. You don't know how their background was like. So definitely we are calling in for public health. More priority should be given to mental health, yeah, so that we can have a healthy and wealthy Uganda. Well, of course, according to a report by the World Health Organization here, as October last year, they said that which was under the theme of making mental health and well-being for global priority. Yeah, so that was their theme last year, and of course it served as a reminder that after all the 3 years, the social isolation that was after COVID-19 last year, fear of disease and death, actually I think mental disorders actually did increase after the COVID, even during the COVID-19 period, because people were isolated, people were in their homes, because now people, those that could not sit eye to eye were in the same house. Yeah, imagine your husband being violent and you're seeing him every day in the house. Psychologically, you're not okay. So, and of course, across the African region, more than 116 million people were already estimated to be living with mental health past the COVID stage. And of course, suicide rates remain particularly concerning, yeah, as the rates, like potential rates of alcohol use and abuse among adolescents as young as a teenage are worrying. Yeah, We've seen different cases of people committing suicide. You go on the news and all you do is suicide. Someone just killed someone. Someone just killed someone over cheating. It's really not okay. Mostly with these youngsters. How can a child start consuming alcohol at the age of 13? It's detrimental and not healthy. And one of the issues they said was inadequate financing of mental health, which continues to be the biggest limitation, negatively impacting the efforts to expand Africa's mental health workforce. Well, as things stand, there are fewer than 2 mental health workers for every 100,000 people. There are fewer so that means there are 2. Imagine two health workers covering 100,000 people. That's a lot. You could run mad as well, because this one has PSTD, this one has anxiety, this one is on drugs, this one is so it's really huge. It's a huge number for quite a small workforce, and of course the majority of whom are psychiatric nurses and mental health aiding. Mental nursing aides. Well, of course, however, there is a heartening that up to 82% of member states are receiving training on how to manage mental health conditions at the primary care level, with up to 74% reporting that specialties are involved in providing appropriate training and supervision to health care professionals. That is why the Honourable actually mentioned something to do with public health, prioritizing public health, so that at the end of the day we could have some productive people who can work in good environments. You could actually your work environment could be toxic, but you could be the change of it. Go with a positive mind. Do not care what people say. Keep positive. That is how you can beat the mental state that we are in Uganda. Well, of course, it's 25 minutes past 9 a.m. and of course you're still watching Smart Minutes Business. My name is Mercy Katsim, and of course we're going for a short breather, but of course we are still coming back to talk matters regarding mental health. We want to wrap it up, we want to seal it here, and we'll make sure that come next week we are all set and ready to fight these disorders that are troubling us.